wanted to first go over a little bit of the income tax so that you understand where I'm coming from when I talk about tax law. Okay, when that amendment was passed in 1913, of course it did not pass without debate, just like it's debated today. And actually, when you read the for and against, it's exactly real. And this guy on the thing with the idle rich, that's exactly what happened. Before that, the tax wasn't, people weren't taxed on their income. And all of a sudden they were going to be taxed on their income. Before that, it was tariffs and stuff. Andrew Mellon, I just put in because I like him. And then I have a couple things about changes of the scope. I want to talk about the income tax began in 1913. 1935 was the Social Security Act. Now this to me is a use of the tax code that is more than just to collect revenue. When the Social Security Tax Act came, understand that women, if you lost your husband and you had 4 kids, you could have starved to death unless your family took you and you couldn't get a job. I mean, that's a fact. And if you did, you didn't make as much as men. And the other thing that was happening then was people were turning, the elderly didn't have enough to live on. So that's why they came up with Social Security, was to fund old age and disability and children with, mothers without fathers. So so you can see they're using the IRS for more than just collecting revenue, which brings me to the new Affordable Care Act. That is a use of the IRS I consider for more than just collecting revenue. Today we have the health care crisis. I don't need to go into that. Most of you know, unless you're employed by a big company or you're on Medicare or you're on Medicaid, you can't afford it. I mean, there's 48 million people out there, or 47 or 46, I've seen all 3 numbers, without insurance, and simply they can't afford it, or they consider themselves healthy enough to not buy it. Now, I think the idea with Obamacare was in part to lower these costs. If we can get these 48 million people insured, many of them are healthy, they'll help keep down the cost for everyone. So I think the main purpose of the Affordable Care Act is to bring these people in so they have insurance, so they don't go to the emergency room when they get sick, and to help pay the cost. Page 3 is a cartoon of sort of what I think is what's happening today. This cartoon was 1943, after the Social Security Act. And I think everybody knows about the New Deal. They started this program, that program, and everything had to be funded. Everything has to be paid for, of course. And it's kind of what's happening today. I mean, there's debates on that. Now, on page 4, I have why are the costs so high? I didn't research. I sort of saw that in an article and took them as verbatim. I think they're pretty accurate. One of the things that I did hear the lady talk about the health insurance today, so I'm going to try not to repeat, but she was concerned. She didn't know where it was going, and I felt I'm a little concerned only because if we're spending $8,000 on insurance and we've got to get down to $4,000, I'm not sure how that's going to. I mean, they have some here, preventative health care it will improve the costs, this and that, but the way we pay providers has got to be looked at, because they're paid, you go in and you're sick, and if there's a 10% chance that they can make you better, they're going to do it. Whereas I'm not sure that's going to happen in the future. You might start to get, well, we're not going to do this. I mean, we're used to getting everything, or we might not get everything. I don't know. She went over a lot of this stuff this morning, and I think it kind of fits in my little page 3 cartoon, a lot of these things. One thing I want to say about the indoor tanning services, though, is that The exception is health clubs. And I want you to understand that health clubs are exempted because they lobbied. They lobbied hard. They went in there, these Planet Fitness big gyms went in and they said, wait a minute, we can't separate the costs. And that's why you support the Farm Bureau. You guys have such a big lobby. And when you talk about tax laws, they do affect your everyday life. I don't know that you realize it, but you have a lot of breaks and you have a lot of senators. Our Senator Toomey likes farmers. So he's going to be supportive of farm bills and things like that. And you may not want to, I don't know, do you join and have dues that you pay? So you may not want to, but you may really think about that. Because these guys are there to protect you. I mean, you're out in the fields working. You're not really paying attention, I don't think, to everything that's going on. When I say the IRS regulates tax preparers, you're probably wondering why I have that in this brochure. The reason I have it in the brochure is because, or handout, is because when you go to your tax preparer this year, you're going to see he's going to ask a lot more questions. I mean, when I filled out tax returns this year, it was the first time it was like the earned income credit. Well, if it's not his son, did you question why the parent isn't claiming them? Did you look at school records to see that and I had to put yes, no. How did you determine that this person was eligible to take this credit? Now, I personally checked other, and then I put observation. I hope that's enough. I'm not sure, but I'm just saying that they are expecting us to be auditors. We never were auditors. The IRS doesn't pay us. Our clients pay us. I don't like it. I don't think anybody likes it, but they're regulating us. If I don't follow the rules, if I don't ask you these questions, how do I know? Maybe they'll say, well, you can't do tax returns anymore. We'll take your number from you. I'm just telling you because the audit rules and the fraud and the penalty is really being looked at, and you'll see they'll ask a lot more questions. The insurance company, okay, they're at the point now where if you don't have health insurance and something happens, you're scared. Because what is it, $80,000, $100,000 for a heart attack? You're done. Like, they take everything. I mean, it's no long. So I think that's partially why they're being regulated, is because the guy from United Healthcare in 2009 was paid $106 million. I mean, I think there's a little bit of abuse there, and I think that will drive down costs when you say you can't pay, you can't deduct more than $500,000. They can pay them. They can pay him $1 million, but they can't deduct more than $500,000. So we'll all need to watch where he goes to get a job.
CEO?
Yes. Yeah. I think she kind of went over, you all know what exchange is and the marketplace and whatever you want to call it. The marketplace, I think they're calling it now. You go in and there's 4 different insurance plans. All insurance plans must cover the essentials. So the debate right now is what is an essential? Personally, I'd like to see dental in there. I think dental's part of medicine. So I should probably call my congressman and say, you know, I want dental. Mental health, how much should they cover? I mean, this is stuff going on now that you really could get involved. I mean, you really could have an input because it's still being debated. They don't know what they do know what the essentials are going to be, but it's not a done deal. And I think you could have some input. The amount of insurance companies can charge is going to be limited. Now, when you pick out these 4 plans, they're going to all 4 be deductibles. You can save probably a lot of money by picking the large deductible. And even though you might think, well, I don't have the money, I mean, think about this. If it's $1,000 cheaper, you could put $1,000 in the bank. And then you're kind of covered because you've got the money in savings and you've got, I don't know, I always go for the larger deductibles. The other thing that's missing from my list is that they're going to require that 80% be spent on medical care instead of executive salaries and advertising, so you might get a rebate. That'll be fun. Now, what she didn't really, I didn't think she went over for small employers. You have a couple employees now. You might. And there is a credit. There's a tax credit that might make it better to stay small. If you're going to have like under 10 employees and you're going to pay them less than $50,000 a piece, if you pay for at least 60% of their health care plan, the government's going to give you a 50% credit. Now, to find out what your credit's going to be, just list the employees, list the amount of health insurance you're going to pay, take it to your accountant. He could put it in his software. And I mean, the credit's nice. That's like money in your pocket. They're going to pay half the plan. I think it's worth looking into. I mean, versus not covering them. If you don't cover them, they can go to the marketplace, which is a great thing because now there's bargaining. You know, we never had that before. We were always, and I'm going to say we because I'm in the same boat. If we don't work for big companies and we don't have insurance and you go out to buy it, it's like, well, you're nobody. You know, you could pay double what Air Products pays or General Motors. You can pay triple their amount. It's not fair. So this is a great thing, and your employees will be able to do that. But you can also provide insurance, and you can figure what it's going to be. And I have here on page 12 the penalties. I think it's pretty easy to read. And that's kind of what's new in taxes, unless anybody here has over $450,000 in income. Then all I have to say is your taxes went up.